India is witnessing a fresh uptick in COVID-19 cases led by the more transmissible OF.7 and NB.1.8 subvariants, both offshoots of the JN1 lineage, itself a descendant of the Omicron strain. Now, these subvariants are behind the sudden rise in infections across India, prompting state health departments to raise alerts and hospitals to step up surveillance. Mumbai has reported 95 COVID cases in May, a sharp rise compared to Maharashtra's 106 cases since January. 16 are hospitalized and testing is now mandatory for all flu-like symptoms. Gurgaon and Faridabad confirmed 3 cases, including a Mumbai returnee and a security guard diagnosed in Delhi. In Chennai, doctors say COVID now makes up 60% of viral infections, prompting delays in major procedures. Pune, meanwhile, has 1 recent case, but 50 hospital beds have been kept ready. Ahmedabad logged 7 cases in 1 day. Authorities nationwide are on high alert amid rising cases. Let me quickly go across to Dr. Sunila Garg, Chairman Program Advisory Committee, NIHFW, former member, Lancet Commission, COVID India Task Force. I'm also joined by Dr. GC Khilnani, Chairman, Department of Pulmonary and Critical Care, PSRI Hospital. A very warm welcome to you. I'll start with you, Dr. Garg. Do tell us, we're seeing a noticeable uptick in COVID-19 cases across several Indian cities. What's really driving this current surge?
The show. First of all, I'd like to tell you that when we were discussing last few months back, and also year back, we also said that COVID has not gone out of our lives. The virus is there; it will keep mutating, and ultimately now latest we had was Omicron variant, and ultimately these are all descendants of Omicron, I'll say, which is JN.1. So that is where, and ultimately when we have got, as you appreciate, that India has got more rising number of elder populations as well, and which are suffering from large number of comorbidities like diabetes, hypertension, and all that. So ultimately, we need to look at from this perspective that we do have Omicron variant, which is highly transmissible, but not necessarily very severe in nature. So that is one of the reasons. And once the virus is there amongst us, it and has not been kind of wiped off, it will keep mutating. We will keep experiencing different strains. The idea is to be watchful. If you will talk to different private practitioners or to hospitals or to healthcare providers, they all will report, see a large number of cases who are coming with fever, cough, cold, which are not responding easily. So you see, basically the reason as of now is JN.1 variant, which is also, kind of descendant of, as I said, primarily BA.2.86, and it is was known as Pirola strain. Idea is to be very cautious, be watchful, and our systems preparedness, which we always stressed right from the pandemic times, that is very necessary in terms of preparedness of the systems. That means our healthcare facilities. But important is to give a message to common public that not to be scared, but our elderlies need to be cautious, wearing masks, when we are practicing hand hygiene and all, those practices need to be practiced. And the second part is that they need to only go out when it is necessary, because they're older people. Any infection in older people is very severe in nature. And we also tell them to take, flu vaccines and other respiratory vaccines like pneumococcal and all, which are part of our, which we have recommended as part of adult immunization, though they are not a part of our national immunization schedule. Thank you.
Continue to stay with us, Dr. Garg. Let me quickly go across to Dr. Khilnani. A very warm welcome to you, sir. Thank you for speaking to News9. Dr. Khilnani, are the new subvariants such as JN1 more transmissible or, severe compared to previous strains?
Thank you, Neha. See, we have to consider what is RO. RO means that if there is a one case on an average, how many cases he'll be infecting, he or she will be infecting. The RO of Wuhan virus was 2.5, RO of Delta virus was 5, and RO of this particular virus, Omicron virus, is more than 8. What does that mean? That means this virus is much more contagious than the previous strains of viruses that we have seen. Another thing is that by and large it does not go to lower respiratory tract and cause pneumonia and ARDS and ICU admission in the immunocompetent or healthy people. So we should expect that this virus would spread very fast. The number of cases, more you test, more you will find it. But the silver lining is that severe cases will be only to the people who are elderly or immunocompromised because of the cancers, or because they are on steroids, or they are on chemotherapy, or they have some rheumatological diseases which reduces their immunity, or those who have underlying chronic lung disease like interstitial lung disease, and so on and so forth. What does it mean? It means that this is the group of people who ought to be more careful. Now, if there is some person who is immunocompromised at home, he doesn't go out, but his family members would certainly go out. They can bring back this infection. So everybody has to follow the kind of practices that we learned during COVID pandemic, where 15 million excess deaths were there. And also another thing is that this this RNA virus is so notorious for mutation. We do not know when it will take a dangerous turn. So we ought to be extremely careful and do a surveillance, and that way government of India is very vigilant. There are advanced laboratories which can map the genome and find out as to what kind of virus is circulating around and take necessary precautions. I do not think there is a time has come for us to take a booster dose for this virus, because that's a very big public health problem. Because this virus does not cause severe illness, so mass vaccination is advised by the Thailand and China authorities, that it only people who are more susceptible, which I have already described, should be considered for vaccination. So finally, there's no place for panic. It's not a This virus is coronavirus was always there. It will keep on circulating in uh, various level of infections, and it is now endemic all over the world. So we have to be vigilant but not worried. Thank you.
Right, Dr. Khilani, continue to stay with us. Dr. Garg, do tell us, what specific precautions, if any, should the vulnerable population, such as the elderly or the immunocompromised, take this time?
As mentioned by Dr. Kilnani also, that when we are taking care of elderlies, they should only go out when it is necessary, but family members also should be cautious, and they should not be, kind of bringing infection. So that means for family members also, when we talk of hand hygiene is very important. But, the life does not stop. We have also got to go sometimes, but definitely, when elderlies go out, and we still see now in airports also, in between also when we were traveling, people do used to wear masks, and this is the time when we can reiterate about masks, particularly for elder segment of population. The second important part is that they should not be neglecting their symptoms, or if family members are there, they should be also cautious about that, and they should also be healthcare seeking should be very prompt, particularly when we talk of, you see, when there are old, and very old. So when we talk of, old, they are persons, who are 75 years and above, or, more than 8 years. In those cases, the infection is definitely more severe. And now government is also thinking of, when we are talking of old, from moving the age from 60 to 65. But nonetheless, when we talk of individuals 65 years and above, we have to be more cautious, and we need not ignore any of their symptoms. And if they're on any of the treatments, particularly when we talk of chronic diseases, they're to adhere to the treatment very, very regularly. So when we talk of hand hygiene, sanitization, या पहले हम बात करते थे, 2 गज की दूरी and all that, it is important that COVID, hygiene has got to be in place. That is also important. And along with that, they must, earlier during our COVID time, we also, said and promoted yoga, meditation, and all those things are very important part of our life, not only in concern of COVID, but in concern of the number of chronic diseases what we are having. So it is important to look at it holistic view when we talk of the population as a whole, and particularly when we look at our elder segment of our population.
Right. Dr. Khilani, you said that there's no need for booster doses this time, but are you sort of suggesting that the current vaccines are effective against these emerging subvariants?
So this is, we know about COVID vaccine much more than we knew when it started. Now, initial studies showed that COVID vaccines, whether it's mRNA vaccine or Covishield vaccine, they reduce the chances of infection. But as the more data came and more experience was there with the vaccine, it was very evident that vaccine mainly prevents severity of infection. It prevents ICU need for ICU admission and death. So as this virus is very, very contagious, and as I said, it does not go to lower respiratory tract generally. So therefore, this, even if you vaccinate the whole lot of population, the transmission is not going to slow down significantly. And vaccinating, as we know that there is already panic about side effects of vaccination, thrombosis, myocardial infarctions, and strokes. So you have to look at the risk and the benefit. So therefore, I am very sure in my mind, this is my personal opinion, that there's no need for mass vaccination for this considering this particular virus. But one has to watch very carefully. Should it take a dangerous turn, then it should be, this may be considered. And if at all somebody is very keen, then only people who are susceptible population that we have already talked about, the vaccination may be considered for that. But so far, the India government has no policy on that. So I think there shouldn't be any panic. And I'm repeating this panic word again because people are going into panic, and I am getting frequent calls about vaccination, about the COVID, and anybody becoming positive goes into frenzy because we have seen so much of catastrophe and deaths around in 2020, 21, and during during this wave that. But actually, if you look at the coronavirus, the history of coronavirus is it has been there for ages. It always caused mild illness, and it was rarely diagnosed, but the difference is that now we are diagnosing it with great ease. So that is why the panic is there. So through your I should be thankful to you for creating awareness among the public about this trivialness of this infection. Another thing which I want to emphasize is that please do not take indiscriminate antibiotics. There's no role of any kind of antibiotics, including azithromycin or whatever, Unfortunately, they are available over the counter. And the moment people get flu-like illness, they start gulping antibiotics. This is counterproductive. It increases the chances of resistance in the community, and also it increases the chances of breakthrough infections, which can be more severe. So do not take antibiotics unless prescribed by a physician. Just follow the person who gets flu-like symptoms must isolate himself, start using mask, start using hand hygiene, try to stay at home. And as Madam said, the susceptible population must not go to crowded markets and places where chances of transmission are very high. Thank you very much.
Right, continue to stay with us, Dr. Khilani. Dr. Garg, Dr. Khilani says that there is no need for a booster dose. But with immunity potentially waning over time, would you say that, is there a recommendation for booster shots?
See, definitely other countries have recommended, but I will say as of now, you see, the earlier vaccines are not going to be effective. If at all, there is going to be a role subsequently. As of now, we don't say because you see, virus is not very affecting very, in a serious form. Infections are milder in nature, and we do not, because as yesterday also I was in another platform where there was a debate about Pfizer vaccine and Moderna vaccine. Those vaccines have caused more havoc, in terms of causing myocarditis and all that. So we need to be cautious that because of vaccines, we do not create another problem. But when we see, that this virus is going to cause very severe infections in terms of hospitalization or deaths and all that, then the consideration can be there. But as of now, the vaccine which is going to be effective is going to be mRNA vaccine. We do have that vaccine, in Indian settings, and we have to see that this vaccine which is available is going to be effective against the latest strains. So the vaccine undergoes revision at regular intervals. But you see, the return on investment is going to be whether we are going to avert that many number of new cases of JN.1 variant. That is the question. So as of now, I don't see from a public health perspective that there is need for a vaccine unless we think of that our elderlies are suffering from very severe infection. I will recommend rather you say our elderly should be taking flu vaccine or pneumococcal vaccines and all that rather than this vaccine. Thank you.
Right, continue to stay with us. Dr. Khilnani, let me ask you this, and I'm sure there are many who would want an answer to this particular question that I'm about to ask you. How prepared is our healthcare system to handle a potential rise in cases, particularly in
So,
urban centers, sir?
very good question. Yeah, but actually, we are prepared because of two reasons. One, that our healthcare system has advanced quite a lot during last 2 decades in terms of. I am intensivist, so I can tell you that the ICU care has from metro cities have percolated to the smaller places. Every district place and even the smaller cities have small ICUs with ventilators and everything. And COVID has added to that. During COVID time, we were not so prepared as it came. And over a period of during the COVID pandemic, which lasted for a couple of years and more, that we are well prepared in two ways. One, that equipments are available all over in terms of ICU care, monitors, and also the uh, skill to handle these cases. I would say both at the government levels as well as non-government level, at the private sector level, corporate sector level, we are extremely well prepared for any kind of escalation of COVID virus. So there's nothing to worry on that. Thank you.